Hello，各位大家好，早晨。Good morning, everyone. 我介紹我自己先。My name is Nida, and I'm the Program Director of AIDS Concern. 大家好，我叫 Nida，我係關懷愛滋嘅項目總監，亦都係今日大家嘅司儀。咁好高興，好歡迎大家嚟到我哋今日嘅 conference 啦。I'm so thrilled you're all joining us today. On behalf of AIDS Concern, I would like to officially welcome you all to our annual conference. 我哋今日嘅題目咧好特別嘅。So the theme of this year is From Science to Society, Addressing Disparities in HIV and Sexual Health. 咁點解我哋會有呢個嘅題目呢？ So this year we want to introduce new perspectives to inquire the issues of HIV/AIDS. 我哋今年咧希望咧有多啲唔同嘅專家啦，其實就希望可以帶俾大家啲新嘅角度啦，去探討 HIV/AIDS 啦、性健康嘅呢一個 issues 嘅。咁所以咧，我哋今日嘅 conference 嘅 structure 係好特別嘅。我哋咧就會係有3部分啦，而嗰3部分嘅組成咧，正正就係性健康3個好重要嘅元素，包括咗 physical health、mental health 同埋 social health in relations to sexuality. So this conference is structured in 3 sections. It's based on the 3 core elements of sexual health, which includes physical health, mental health, social health in relations to sexuality. For each of this section, our speaker will guide you through to explore social and structural determinants impacting one's sexual health. We'll also inquire intersection between different areas of health, sexuality, and sexual health. We will also share and exchange ideas on building a sustainable, inclusive, and equitable environment and service model. 我哋都希望啦，可以多啲機會啦，去探討啦。其實喺我哋講緊探討 HIV 性健康呢個 issues 咧，背後咧其實有好多唔同嘅一啲嘅元素啦、大環境啦，其實係會影響到我哋嘅性健康。希望就從而可以探討多啲有一個咧嘅環境，我哋嘅 service model 啦，點樣可以再做得好啲，去可以提升大家嘅性健康。So by starting this dialogue of all these topics today, we hope to inject new energy into our HIV responses, break down the service silos, and join hands with you all to promote holistic sexual health. So it's a full day event. 你哋睇到本 book 啦，嗱，今日係成日嘅 event 嚟嘅。So let's get started with an opening speech from Jerome, our Chief Executive of AIDS Concern. 有請 Jerome。
Good morning, Dr. Wong, Mr. Chu, Professor Kwong, distinguished speakers, fellow participants and friends. It gives me great pleasure to welcome you all to AIDS Concern Conference 2024, titled From Science to Society, Addressing Disparities in HIV and Sexual Health. We aim to reinvigorate our response to HIV and other sexual health issues. By bringing together academic experts, health professionals, social workers, and community health leaders, we strive to break down service silos and take concrete actions to address social and structural determinants of health. As an NGO that works at the forefront of the local battle against HIV, we have seen those scientific achievements in HIV research in the last 4 decades that have led to tremendous progress in both treatment and prevention of HIV and AIDS. And it is now within our reach to end the epidemic, but we can't just rest on our laurels. We need to rethink and re-energize our response not only to HIV, but also the broader health issue of health inequities. The World Health Organization has made it very clear, and I quote, "Health inequities are systemic differences in the health status of different population groups. These inequities have significant social and economic costs both to individuals and societies." Now that is the reason why we are here today. We look at the sciences and to exchange views on how to turn scientific knowledge into catalysts for service excellence and social betterment. Today's conference touches on a wide array of topics and covers the 3 core elements of sexual health, namely physical, mental, and social well-being. By studying new ideas and synergizing between different models, we can find effective ways to tackle health inequalities, thus making our society healthier and better. I want to take a moment to acknowledge and thank our esteemed speakers. Also, a big thank you to our platinum sponsors, GSK and Gilead Science, for their support. Today's event wouldn't be possible without their support and generosity. So let's join hands together to champion a holistic approach to sexual health and work towards a more equitable future. Thank you. And may I now introduce Dr. Bonnie Wong, consultant, Special Preventive Program of the Department of Health, to come forward and deliver her welcome remarks. Thank you.
you. Jerome, Travis, and Mr. Ju, distinguished guests, ladies and gentlemen. First and foremost, I would like to express my heartfelt gratitude to AIDS Concern for organizing this AIDS Concern Conference 2024. It is my great pleasure and honor to be invited to deliver the welcome speech for this meaningful event. If you read along the program, you appreciate how the organizers had thoughtfully brought together a distinguished panel of speakers who are going to share with us their vast knowledge and expertise in their respective domain related to the prevention and control of HIV under this meaningful theme, addressing disparities in HIV and sexual health. Well, this year, year 2024, is a special year, as it marks the 40th anniversary of the first HIV case being reported in Hong Kong. Throughout the past 4 decades, the government, health professionals, academicians, and the very, very crucial NGOs, and among them AIDS Concern, have made concerted efforts in the fight against HIV. Indeed, as my colleague Dr. Lisa Yip is going to share in her talk later today, we are glad to witness a steady decline of the newly reported HIV infections by 40% over the past 8 years, from its peak at over 700 cases in 2015 to less than 400 cases in 2023. I would like to extend my deepest gratitude to everyone who came before us and our peers with whom we are now working together for the contributions to the field. Their unwavering professionalism and tireless dedications have made a significant impact on the prevention of and treatment of HIV in Hong Kong. Well, despite this trend, as Jerome has already mentioned, there is in fact no room for us to be complacent. We are being confronted by multiple challenges, such as late presenters, the static, if not rising proportion of people who actually present late with advanced HIV disease, the disproportionate presentation among ethnic minorities, and the static number of cases among non-key populations. And above all, the stigma and discrimination that still exists despite 40 years of very promising medical advances. So my fellow teammates, I believe it comes the time when we have to work even harder, not on our own though, but join hands and work focusing on the intersectoral collaborations that we just mentioned, overcoming different social and structural barriers in order to address the needs of our clients and to narrow the gaps in our service provision. In line with this objective, I'm actually very pleased to share with you the government's new initiative, the Commons, Yattong, which provides a one-stop integrated service under the person-centered care concepts. As its English name implies, the Commons symbolizes the mission of converging the power of caring and inclusivity from stakeholders. And its Chinese name, Yattong, implies, we are actually working hand in hand with the service recipients. While the Commons serves to address the overall well-being of individuals that's been highlighted in this seminar, it is also highly committed to maintaining and fostering close collaborations with local and regional stakeholders, with a hope to contribute in cultivating a supportive, inclusive, and enabling environment for care seekers. And other colleague of mine, Dr. Heatherdoe, will be sharing what the Commons does in the afternoon. Last but not least, allow me to extend my warmest welcome to our speakers and friends from Singapore and from Thailand. At the same time, I also look forward to the excellent presentation from our local partners who are to offer invaluable insights to the discussion today. In closing, on behalf of the Department of Health, I wish this conference a great success and all participants a most fruitful and enlightening experience, gaining not only knowledge from the science, but also bringing forth innovative programs to the society, addressing the disparities in HIV and sexual health. I thank you all.
Dr. Wong. Thank you, Dr. Wong. So now I would like to invite Professor Travis Kong, who is the professor of Department of Sociology, the University of Hong Kong, and who is also the chairperson of AIDS Concern Board, to come to the stage to say a few words for us. Thank you.
Well, good morning, honorable guests, speakers, practitioners, friends. It is my great pleasure to welcome all of you to come to our AIDS Concern Conference 2024, titled From Science to Society, Addressing Disparities in HIV and Sexual Health. This conference actually is really important for us because it marks a crucial milestone for AIDS Concern in the way that we recognize the intersection between scientific progress and advancements and societal impacts in the realm of HIV and sexual health. As AIDS Concern, our mission has always been to empower individuals living with HIV and AIDS, prevent new infections, and also to promote health and well-being of all individuals, particularly in the context of sexual health. So this conference is so important because it is the way that how we recognize the pressing need in terms of disparities in this field and ensure that scientific progress in some way can actually translate into tangible improvements in our lives. This conference is a really excellent platform to engage with cutting-edge research like innovative sexual health model and also evidence-based practices. We have renowned speakers from many different disciplines, such as like in healthcare, academia, and advocacy. So today you know that they will tackle and examine many different issues, such as like access to care, talk about mental health integration, social factors that leading to different types and forms of disparities, and also the unique challenges that some minority communities have been facing. And so together, I'm sure we will explore and also address and think about and formulate effective strategies in order to reduce disparities, combat stigma, and to ensure equitable access to comprehensive HIV prevention, treatment, and care. Okay. Please allow me, to express my really heartfelt appreciation and gratitude to our organizing committee and to our honorable guests and speakers, and also to our platinum sponsors, Gilead Science and also GSK, for their invaluable contributions to make this conference possible. Okay. So in conclusion, I welcome you all to come to and enjoy this conference, and I'm sure by sharing our collective knowledge and practices, we'll think out the way how to reduce and address the different forms of disparities, as well as we can actually try to rebuild a society where every single one can access to health, to quality health services equally without discrimination. So really hope you all enjoy today's conference. So may I now invite Mr. Ricky Chu, the chairperson of the Open Opportunities Committee, to come over and to speak a few words. Thank you.
Jerome, Bonnie, Travis, distinguished guests and friends, good morning. It is my honor and pleasure to be invited today to join you for this very meaningful conference. And from the Equal Opportunity Commission's perspective, the treatment for and prevention of HIV have undergone significant transformation since the first case of the infection was recorded in Hong Kong 4 decades ago, as Bonnie has mentioned. With advancements in the antiretroviral therapy, people living with HIV are now living longer and healthier, with AIDS-related deaths becoming less and less common. The availability of pre- and post-exposure, as well as self-testing measures, have also greatly reduced the risk of transmission. Hong Kong's response to HIV is undoubtedly showing positive results, as evidenced by the fact that the number of HIV infection reports has decreased for 8 consecutive years since its peak in 2015. As the Hong Kong Advisory Council on AIDS made clear in its latest strategies, the goal is to end the AIDS epidemic as a public health threat in this city by the year 2030. Yet, as medical treatment and prevention for HIV have advanced drastically, societal attitudes towards people living with HIV have not progressed at the same pace. Myths and misconceptions about HIV and AIDS remain prevalent. While people who are HIV positive are often faced with stigma, discrimination, and society exclusion. Evidently, such attitudes are detrimental not only to their physical health, but also to their mental well-being. Whether in the form of a joke, verbal abuse, or job termination, such a stigma and discrimination rob people's right to live a life of dignity. These acts can cause people to hold themselves back from seeking help and treatment, the delay of which will not only put the individuals in greater risk, but also cause a negative impact on the wider society's management of the HIV epidemic. The Disability Discrimination Ordinance protects people living with HIV from discrimination, harassment, and verification. As the public body tasked with the implementation of the ordinance, the Equal Opportunities Commission has taken a multi-pronged approach to combat the stigmatization of people living with HIV. In terms of enforcing the law, we have been handling complaints related to HIV and AIDS. By conducting investigation and assisting its conciliation, the EOC provides a channel for those living with HIV to seek redress when they have been discriminated against or receive less favorable treatments. Our complaint handling mechanism also enables us to monitor the patterns of discrimination and devise policy recommendations accordingly for broader change in the society. Prejudice against the stigmatization of people living with HIV often stems from a lack of understanding. It's therefore essential to tackle misinformation about HIV and AIDS through education. Through our engagement with stakeholders in different sectors, such as the hosting training workshops for employers, we have sought to educate the public on appropriate ways to interact with people living with HIV, enhancing understanding of their legal rights and protections, and promote their acceptance and inclusion. And we also see the education of the next generation as an indispensable step to eradicate the stigmatization of people living with HIV in the long term. As our own research has shown, there is, unfortunately, a lack of sexuality education in schools. We believe there needs to be a comprehensive reform of the current guidelines on sex education, and have included this proposal in our submission for last year's policy address public consultation. We are also making use of multiple channels, including the social media and the Equal Opportunity Youth Ambassador Scheme, for tertiary students to instill in the younger generation values of empathy, inclusion, and respect. Indeed, to truly transform the lives of people living with HIV, we need to correct misconceptions, challenge outdated thinking, and change the way society sees HIV. I've no doubt that the discussions and insights this conference inspires will move our society in the right direction. And I look forward to working with you all to make the vision of zero stigma for people living in HIV a reality. Thanks a lot.